I am Terry Ricks, the Department of Children and Family Services Deputy Secretary, and I'll be speaking with you about several services that may be useful to you as a survivor of many events that happened in our state this past year. Let me explain to you that we know that there are many agencies that are assisting you during this time, and that this can be a very difficult time. And so as we go ahead and get started, I want you guys to remember the numbers 211, the number 211. Should you get lost in any of the resources that we talk about today, if you can remember to call 211, you will be able to find resources that can assist you throughout this time. So again, I'm Terry Ricks. And let me tell you a little bit more about DCFS. Our mission is to help keep children safe and to provide individuals and families with the help that they need to be self-sufficient. And we are the agency that provides shelters for everyone whenever we are in a disaster. This year, as you know, has been a year of unprecedented need. Maybe someone you know or yourself may still be in need of food assistance, be able to have help with child support payments, are concerned about the stress of being a caretaker and the concern for children that may be in your care or someone you know care. There have been more families than ever recovering from disaster. So if you find yourself there, DCFS may be able to help, as well as some of our partner agencies. So our department is made up of child welfare, and that includes whenever there's a need for child protection investigations or any types of services for families, foster care, and adoption. Our family support area, which is where you would find SNAP and also TANF. So those are food services, federal food benefits, child support. We also do disability determination services. We do have an Office of Fraud and Recovery in that section. And then, like I said before, we do emergency preparedness and recovery work related to shelters and mass care. The information that you see next is a number that I want you guys to write down. And again, if for some reason you don't have that information, this information in front of you, if you were to dial 211 to know what to do to report child abuse, then they would give you 211 would give you this number. And it's a number that we all need to have. And you can find all this information also at the DCFS website, dcfs.la.gov. I'm sorry, dcfs.louisiana.gov. 1-855-4LA kids is the report child abuse number. Also, if you need help with parent locator services, paternity establishment, or setting up a determination for child support or medical support of a child in your home, we do child support order enforcement, and actually anyone is able to apply for that service. You don't have to be a low-income person, so to speak. Anyone can can apply for child support services. So if this is something that you're struggling with, or you are one that needs to be giving child support to someone else, please know that we may be able to help you, especially if you need a modification or other things. Like I said, some of the family support programs do include SNAP or cash benefits. Are you someone that's helping with a family member's children, for example? That's what kinship care is. And then also the Louisiana Combined Application Project. That program is for those who are elderly. Again, we have DSNAP. So we don't have DSNAP open right now, but we've had 7 DSNAP applications periods during this time. We also provide workforce-related services. So if you need something, I think we may be able to help. DSNAP is right here. If you went through any of the events and you did get disaster SNAP, then you are already pre-registered in case you would need it at another time. I think it's important to understand that DSNAP is only for people who are not our regular SNAP recipients. And so a regular SNAP recipient would never apply for DSNAP, the disaster SNAP program, but anyone can pre-register for a DSNAP for sometime in the future in case you come into contact with a disaster and may need that benefit. Pre-registering is not applying. If you need help with anything from the Department of Children and Family Services, you can call directly to our, what we call LA Help You Customer Service Center. The number is on the screen. You can also send an email to lahelpyou.dcfs. So 1-88-LA-HELP-YOU will reach us. lahelpyou.dcfs at la.gov will reach us, I'm sorry. And if for some reason you just can't remember all of that, then dial 211, and our friends that run the 211 information referral service centers throughout the state will be able to not only connect you to DCFS's service, but most all services from non-governmental organizations, local parish or city government referral and information services in your area or state. So that's a good number for you to keep at your fingertips as we go forward. I'm going to move a little bit away from DCFS and talk to you a little bit about what we know about what's going on with people in opioids. Our friends at the Louisiana Department of Health has given us some of this information. Unfortunately, we have seen in 2021 many overdose deaths in Calcasieu Parish. So far, at the writing of this, it was 25. That is really a lot. We want to make sure that the overdose deaths could be doubling this year. So we want to make sure that as this trend continues to accelerate, we want to make sure that we provide information to you that you can get out to the people that you know and love, and then for yourself. There are some very potent drugs on the street right now. We've talked to coroner's offices who really have a front row seat to the worst of the opioid crisis. They are alarmed at what they are seeing. The highest potency levels they have ever encountered by a lot. Past rates of fentanyl were like 3 or 4, and now they're seeing rates all the way up to 80. That is enough to kill a couple of classrooms full of students. They consider it to be one of our top public health emergencies right now. This is probably the most important graph that our friends at LDH want you to see. What this means for the region is that the coroner is keeping an eye on our overdose rates. They increased from 45% in 2019. They increased by 45% from 2019 to 2020. So let's make sure that we are getting information out about what resources are available to us. And so on the next slide, we'll see that there are resources. I think, do you have one slide before that one where we can get to the general opioid information? Okay, so I have a slide that you don't have. So let me make sure, it may be out of order. Let me make sure to give you guys this telephone number. General opioid information can be reached from the Office of Public Health. And the number there is 337-475-3215. 337-475-3215. There's a Narcan distribution. Also, there's a hotline, 337-930-2386. I want to again make sure to tell you guys that if you are not able to take down this information, you can call 211 to get this information. The other thing that our friends at LDH wanted to talk to you about is that there's so much fencing down from the hurricanes that we have a very high risk of drowning. This means that swimming pools are not, protected the way they should be. And so we need to be extremely aware of the risk and take all the precautions we need to make sure that we prevent the increases in drowning deaths. So it's important right now to make sure we're keeping an eye on our children and those who cannot swim. The other thing we want to talk about is that there are many people who are displaced right now. We may be sleeping and staying in places that we would rather not be. We're not at home with everything that we once had. Or if we are in a space where we are in a homeless situation that even we may have been in beforehand, we need you to know that there is a safe sleep task force that would make sure that any family has everything they need to have a baby sleep safely. So we can use pack and plays, we can use a baby bed, but there are some things that we don't do. We do not put an infant, for example, on a water bed, or we don't let them just sleep all day in a bouncy sleep, in a bouncy seat, for example. Couches are not okay. Sofas and chairs are not okay. So if you are someone who needs a resource for any child, any infant, for a safe sleep, I'm going to ask you to call either 211 or 337-477-7537. The coroner's office has a safe sleep task force, and they will find you the crib or whatever you may need to provide, to get you the equipment that you need for the infants in your life to sleep safely. Also want to make sure to let you know that there is much more information about public health in your area at the Louisiana Department of Health's website. We really want everybody to stay healthy. It's not just about COVID-19. It is about everything. And so you can find lots of information on the public health in Region 5's website. There's, an immunization program that's outside of COVID-19. There's a program called Nurse Family Partnership that will allow for a new mom to get assistance from a nurse. There's the WIC program that is set up so that people can find the right nutrition for their babies and for the women if they are postpartum, and for their children. They have information and assistance for reproductive health and health units in the area to assure that everyone can have the health care that they need. But we are in a pandemic, and so we want to make sure that you know that you can get a COVID-19 vaccine for free. And as you know, the governor is really requesting each one of us to consider getting our COVID vaccine. This is the way that we can really move out of this pandemic. And so if you were to call 211 or your public health center directly, you will find a COVID vaccine site, and that COVID-19 vaccine will be free to you. So we really want to encourage everyone to be vaccinated. We have information that the vaccines are safe and effective. They have been tried and tested, and they have shown themselves to be effective. So we really encourage everyone to take the vaccine. And if you have any questions about what to do if you get COVID, or if you're looking for a vaccine, and if you call 211, you will be able to find resources to help you get through a case of COVID, or to find a vaccine which will allow you to hopefully not get COVID. I now want to move on from the public health part of our friends at Louisiana Department of Health and move on to the Office of Behavioral Health. We want you to know that there is a Louisiana Spirit crisis counseling program that is currently open for all the survivors of the 2020 storms. And so this the Louisiana Spirit Crisis Counseling Program is made to assist individuals and communities in recovering from the effects of disasters through the provision of free, community-based outreach and psychoeducational services. So how do I get a little bit of support because my mental health is not okay? It is the Louisiana Spirit Crisis Counseling Program that will allow you to get that. So this disaster recovery program is operated by the state, but it is also a federal program that has been provided through FEMA and administered by the Substance Abuse and Mental Health Services Administration of the federal government. And so we want to make sure that you know that there is help available. The Louisiana Spirit Crisis Counseling Services are normally designed to be provided door to door, but due to COVID-19, we are providing services virtually. So we have been working with Hurricane Laura and Delta survivors in the hotels, the non-congregate shelters, and at community events. But right now, the largest majority of our services have been on electronically. So we want to make sure that we can get you connected to the Metropolitan Human Services District, the Capital Area Human Services District, Central Louisiana Human Services District, Northwest Louisiana Human Services District, or the Florida Parishes Human Services Authority, who are assisting with that administration. And again, if all this seems Greek to you, pick up the phone and call 211, and they will find the Louisiana Spirit entity for you directly. And so this short-term intervention will provide crisis counseling to you, also public education about how to cope with all the matters that come with the recovery, managing the stress for all the services and dealing with government assistance and the relationships, et cetera. So we want to make sure that you know that help is available to help us cope through this area. So those services are available in all the parishes that have been impacted by Laura, which basically pulls in those who've mostly been affected by the other events as well. This has been a huge event. The magnitude has resulted in lots of damage and has definitely affected the well-being of all in the communities. And so with that, I want to make sure that none of us feels like we are alone. If you are feeling down, or if you are feeling like you're not sure if you can make it, please know that there are many others feeling the same way. And that is why the federal government, the state government, and your local government, as well as the local partners of your governments, have determined that we want to make sure that we have this resource available to you to cope with the stress of all of this. And so we're not just targeting those who have been directly affected and maybe are still out of their household, but also the healthcare workers and first responders and the religious leaders and everyone who has been impacted, particularly paying attention to special populations. So if you're feeling this way, I promise you there's someone else around you is feeling this way. So let's check on one another and let's know that there is a resource for us, and let's get the help that we need. The Immediate Services Program is part of the grant program that provides disaster relief assistance for up to 60 days. And so we want to make sure that you get what you need. So I'm going to move a little bit further. We've done a lot of work already, but there's a lot left to be done. So let's make sure that we're directing people. We have on the screen here a few of the tools and techniques that can be utilized These are some things that a counselor will be able to walk you through. I also want to, if you can go on to the next slide, please, Lexi, I appreciate it. A little bit more. We went over a couple of those. And here, thanks so much, Lexi. Want to make sure that people have this information. There is a keep calm line. There's also, if you don't really want to talk to anybody, you can text, reach out to 741-741, and you can text with someone, which sometimes just even talking about it just seems too much. But if you are wanting to use texting, this is a great program that has been brought into Louisiana since 2020. And again, if any of this is just too much, then please call 211 and we will be able to get you connected to these resources. We definitely want to conquer COVID. And so if there's any questions that you have about how to stay well during this time of COVID-19, there are resources at conquercovid19.la. Again, you can call 211 or you can reach out directly to LDH or DCFS and we will get you to the right place. I'm so very excited to be able to have one of my colleagues also here with you. I want to introduce Dr. Timmel, Quintina Timmel, to be able to tell you about some virtual disaster resources coming from the Louisiana Department of Education. Dr. Timmel.
Good afternoon, everyone. Thank you for having me here today. I also have my colleague with me, my Executive Deputy Chief of Staff, Alexis, and she's here to support and potentially share a few additional resources with you. Again, my name is Quintina Timmel. I serve as the Chief of Staff for the Louisiana Department of Education. I'll be sharing with you today our disaster recovery resources. If you have any questions about any of the resources we share today, please feel free to reach out to our communications inbox at LDOE communications@la.gov so that you can connect with the appropriate LDOE staff members. Let's move on just to give you a little insight about Believe to Achieve, which is our recently released priority plan. Believe to Achieve serves as the department's roadmap for improving outcomes for all 800,000 of our Louisiana children. It includes the department's new belief statements, state data to help track progress towards Louisiana's 6 critical goals, and the new priorities that will direct our efforts as we work toward achieving the critical goals for all students. Each priority outlines focus areas for key actions and initiatives, which will really define the work that we will do in the Department of Education. So from the Office of Operations, I would like to share with you some information about our summer reading program. Usually if you see this in writing, you will see this by SFSP. It is a federally funded, state-mandated, state-administered program. It reimburses program operators who serve free, healthy meals and snacks to children and teens in low-income areas. During disasters such as hurricanes or COVID, the Summer Food Service Program may be an option for you to support the nutritional needs of children in your community. For more information, please refer to the SFSP checklist to guide you through the process. You may also contact our children nutrition programs at la.gov, or you can call the number 225-342-9661. And here's a little bit more information about the Feeding Network and where we have the Second Harvest Food Bank, as well as the Food Bank Northeast Louisiana, the Greater Baton Rouge Food Bank, the Food Bank of Northwest Louisiana, and the Food Bank of Central Louisiana. This slide contains locations of the Feeding Louisiana network. Please visit the Feeding Louisiana website to find a food bank near you. Next, as we think about opportunities for students and families, we are so excited to present to you the Federal Communications Commission, FCC, recently launched an emergency broadband benefit for families. Over the last year, we have experienced an unprecedented need for emergency broadband benefits for families. To meet this need, the FCC has launched an emergency broadband benefit program to assist eligible households or school systems in paying for home internet services during the pandemic. You see all the details contained on this slide. The emergency broadband benefit will provide a single discount of up to $50 per month toward broadband service being provided to eligible households, and up to $75 per month for households on tribal lands. Again, you have all of the information located here. A very important link is also embedded within this document for you to get additional information and to get updates released by the FCC. Another piece of information that we're really excited to share with you all is we as a state agency, we do not directly provide summer learning programs to students, but our role is really to help our school systems or other learning communities enrich our students' summer experience. And so what we've done as an agency, as a state agency, is we've worked with school systems, and we want to make you aware and empower you with questions to ask in your local school system. So summer learning programs are designed to provide students with additional opportunities for learning and growing during the summer months. We have encouraged our school systems to create opportunities for all students to access a robust summer learning program. To support school systems in providing enriched learning programs for K-8 students, we have released guidance. We are asking our school systems to implement summer programs that really structure and that provide structure, resources, staffing, sample schedules, and checklists. And most of all, we've asked them to make sure our students have fun by incorporating the arts and music and STEM camps. So please ask your neighboring school system or school, what plans do they have for students for the summer? We are also excited to partner with the governor in realizing the need for all of our students to not only be academically whole, but also socially and emotionally well. So through the Governor's Emergency Education Relief Fund, all public and private school students will be provided free access to Edgenuity's online social and emotional SEL content library. Such courses for students include character and leadership development, college and career readiness preparation, mental health and wellness, personal development, social and emotional success, and unlocking your purpose. You can reach out to your school system or your local school and ask how can you participate in this program, or you can contact edtech@la.gov with additional questions. We know that childcare is a really important aspect of a thriving community. So to support all families in accessing high quality childcare, the Child Care Assistance Program, also known as CCAP, provides financial assistance to low income families while they are working or attending school. So any families experiencing homelessness, by lacking a fixed, regular, or adequate nighttime resident may qualify for child care assistance for up to 90 days without evidence of employment. So again, you have information on here about applying online. We have applications in English, Spanish, and Vietnamese. Any questions concerning CCAP can be addressed by contacting the Louisiana Department of Education. You see the phone number 1-877 453-2721 or by emailing ldecap@la.gov. I know immediately there will be questions about eligibility. And so for your reference, we have just a highlight about the recent changes in the eligibility requirements that we have made more, that will make more families more eligible than ever before. So this slide lists the application process for you and then gives some eligibility descriptions. Just as we talked earlier about mental and social well-being supports for our K-8 students or our high school students, we also have our TIKES Early Childhood Mental Health Consultation Program. This is a partnership between the Department of Education and Tulane University. It provides free mental health consultation across Louisiana. The TIKES mental health consultants are licensed mental health professionals who have been trained in infant and early childhood mental health. Again, you see more information about making an appointment through tele-MHC sessions, or you can connect with TIKES. You can reach out to the email address on the screen, https://tinyurl.com, Tulane TIKES for more information. Through our Office of Equity, Inclusion, and Opportunities, we have mentioned twice now that we have services for our students for social and emotional well-being. Well, we cannot neglect our educators. What we do know about the pandemic and any crisis that we have experienced, that in order for students to be well and whole, so must the adults. So we are really excited to bring teachers services around mental health and well-being. So we know and believe that teachers are a part of our community and they are the most valuable asset in our educational community alongside our students. We know that if our teachers are healthy and whole, they engage with our parents more readily and that they provide a strong support system for our students. So we want to make you aware of efforts we are taking to support our educators. We are encouraged by ensuring the health and safety and mental well-being of school support staff that have been serving on the front lines for the good of Louisiana students. So you see that we are offering our teachers free teletherapy to all educators. We have invested about $1 million to this project to ensure that we can take care of those that are taking care of our students. So educators and support staff will have access to 4 completely free and 100% confidential counseling sessions with licensed mental health professionals. We are partnering with Ochsner to provide this service. So we have a few guidelines here on the next slide that speaks to how this is working. But Ochsner has built a custom online platform and hired additional mental health professionals to staff this initiative. Again, you and our teachers must have a laptop, a tablet, or a smartphone in order to schedule and participate in virtual teletherapy anywhere, from anywhere. Again, this anticipated launch date, we're doing a soft launch date, which we started April 19th. If you need more information, you can definitely reach out to any of the email addresses or phone numbers that I've provided before to ensure that you have, or you can even share access to this information with educators. Last but not least, we have a slide that we're covering from our Believe to Achieve Louisiana Act Now. So while we realize that we're talking about many supports for social and emotional and mental well-being, we are thrilled to prepare and to provide for our students Louisiana ACT Now. So what is that? This program provides funding to purchase pre-billed ACT test vouchers for eligible students in grades 10th and 12th. Vouchers purchased from ACT must be used for one of the 3 ACT administrations. So what we're really excited about is for all 11th grade students in the state of Louisiana, the state, the Department of Education pays for students to get ACT results. What we've realized is that we want this opportunity to be provided to all students. And so with that, we are providing 10th graders with access to ACT vouchers, as well as 12th graders who may want to retest and to try to get an increased score. So again, ACT Louisiana Act Now is available in all school systems. You can reach out to a school counselor to obtain additional information.